C.
J.
D.
Creutzfeldt-Jakob disease, also known as CJD, is a degenerative neurological disorder caused by an infectious protein. CJD is a rare and unique disease that infects an estimate of 1 out of every 1 million patient per year. The first two scientists who are given credit to the discovery and documentations of CJD are Hans Gerhard Creutzfeldt and Alphonse Maria Jacob. However, limitations of the resources and rareness of the patients affected by CJD led to the disadvantages of the studies of this disease. Furthermore, at the time, the idea of the infectious proteins being the cause of this disease was highly controversial. Creutzfeldt-Jakob disease is commonly seen in older patients from 45 and up. It is extremely rare to see it in younger patients. Although not fully correct, studies have discovered that CJD occurs more highly in places like US, Canada, and Northern England. This conclusion is probably due to the massive consumptions of cheap meat products in these areas.
There is currently no single diagnostic test for CJD. When a doctor suspects CJD, the first concern is to rule out any treatable forms of dementia, such as encephalitis, which is inflammation of the brain, or chronic meningitis. And the only way to confirm the diagnosis is by brain biopsy. In a brain biopsy, a neurosurgeon removes a small piece of tissue from patient's brain so it can be examined by a neuropathologist. However, this procedure may be very dangerous for the patient, and the operation does not always obtain the tissues from the affected part of the brain. And because correct diagnosis of CJD does not help the patient, a brain biopsy is discouraged unless it is needed to rule out a treatable disorder. In autopsy, as we know, the whole brain is examined after the death. CJD is characterized by rapidly progressive dementia. Initially, the patients experience problems with muscle coordination and personality changes, including impaired memory, judgment, and thinking, and impaired vision. They may also experience insomnia, depression, or unusual sensation. It is worth to mention that CJD does not cause a fever or other flu-like symptoms, and as the illness progresses, patients' mental impairment becomes very severe. They develop involuntary muscle jerks called myoclonus, and they may go blind. They eventually lose the ability to speak and move, and they enter a coma.
The causative agent of Creutzfeldt-Jakob disease is a prion, which is an abnormal, acellular, infectious agent which lacks a genetic component and is made entirely of protein. Prions which cause Creutzfeldt-Jakob disease are believed to occur sporadically, caused by spontaneous transformation of normal prion proteins into abnormal prions. Prions are transmissible from host to host of a single species and sometimes from one species to another. A small proportion of those who acquire Creutzfeldt-Jakob disease do so because of inherited mutations of the prion protein gene. Prions induce abnormal folding of normal cellular prion proteins in the brain, leading to brain damage and the characteristic signs and symptoms of the disease.
I'm going to talk about the prevention and treatment of CJD. First, the prevention. Exposure to brain tissue and spinal cord fluid from infected individuals should be avoided to prevent transmission of the disease. Avoid contact with any surgical instruments used on CJD patients. So far, unfortunately, there is no treatment that can cure or control CJD. Researchers have tested many drugs, including steroids, antiviral agents, and antibiotics with no success. Studies of a variety of other drugs are now in progress. Drugs may be needed to control pain and aggressive behavior associated with the late stages of CJD.